I've always been curious, and I think all health professionals will say that they all, they always in their life wanted to help someone feel better, help someone get through an illness. Um, it was that, but also I had a curiosity, especially with medications, on how they work, how they make somebody better. What chemical structures is going on, what's making that drug the right drug for whatever is happening with that patient. So I always had that curiosity. Then when I got into college, I kind of was just around a bunch of students that were into healthcare. I was a president of a small healthcare organization for the students, where we got to go around and experience different things in the healthcare community. And I ended up getting a job actually over here on the West Campus. So I was on the East Campus at UIC. The job was over here at the West Campus. I became a surgical auditor, which was just examining the medical record after surgeries to make sure the anesthesiologist had signed the record so they could get paid. But while I was here, a job opening came for pharmacy technician, so I thought I'd check that out, and I became interested in that. And then I talked to one of the counselors over at UIC to become a pharmacist. So I ended up actually leaving here, going to Wisconsin, but then I ended up coming back. But I went to Wisconsin for pharmacy school, became a pharmacist. So that's kind of my track. And I've had other positions at different areas in retail with Walgreens and even in a prison working as a pharmacist. But I did end up back here at UIC. So I'm very happy to be back, and I've been here a little more than 20 years.
Initially, didn't plan on doing pharmacy. I went into undergrad looking to do engineering. And then I took physics, and I was like, never mind, not gonna do that. The next logical step was pharmacy because I had been exposed to it from a young age. I'd always wanted to get involved with the sciences. That was always my goal, even before getting into undergrad. So I didn't want to do all the long route of being a doctor. So was the next best option in terms of being able to be involved with healthcare and things of that nature. So sure, definitely, my experience as younger with my mom bringing me to the pharmacy and exposing me to, her technicians she's worked with and other pharmacists, and that did help push me in the direction of going to the pharmacy.
I was very proud that we have three boys, that one of the three kind of followed in my footsteps. The other two are kind of IT like their father. But the exposure, I see that made a big difference for him to, see what pharmacy was about, the teamwork, how friendly, all the staff was whenever he came around, and showing him, what we were doing and how we were doing it. And it's just, a really proud feeling to have one of your children, just kind of following your footsteps. Just having him here and being able to talk back and forth about his part of pharmacy, because there's so many different aspects of pharmacy that I enjoy here at the university. Um, there's a teaching aspect, there's the one-on-one with the patients. I'm on the outpatient side, he's on the inpatient side. So who he sees is who I get. After a while, he makes them better and gets them out the hospital, and then we on our side try to maintain that with the patient. So it's just a really great relationship, just to talk over what's going on hospital wise and what's going on outpatient wise. It's just been a really proud thing for me. I guess I kind of can give him how it used to be, and um, how it's progressed and changed, and I guess he can look at how it can get better. but I can give him like at least the historical perspective. I mean, even recruiting him into pharmacy, I did tell him that, pharmacy used to be all men, and now it's like 75% women. It has changed so much, and I kind of can give him that perspective of how it has been, how it's changed, how things are getting better, how pharmacists are much more involved with patient care than they used to be. We used to just be behind the counter and we just filled the prescription and weren't that involved with the doctors other than maybe getting a correction. Now we're very involved in the patient's actual care, helping the doctor pick the correct medication, advising the doctor on how well they're doing on that medication and do changes need to be made accordingly. We see the patients more than the doctors see the patients, so we kind of have a little bit of a stronger relationship with that patient. And just all the changes have made really a lot of difference in how pharmacy has, become a major partner with the doctors and nurses in caring for patients.
Most of the back and forth comes with, hey, how are you doing things? This thing's on this side of pharmacy versus how we're doing things on my side of pharmacy. The most important information I feel like I got from her is how to deal with the more difficult things, and dealing with difficult patients, dealing with the stress of the job, all the time management, all the things that, you don't really hear going into it until you actually start working as a pharmacist. And, it was definitely difficult when it first started because I wasn't used to that type of stress and pressure. But it was helpful to hear from my mom, how she handled it. And I definitely use what she's told me to this day, and it's helped me a long way to come where I am.